surprise you that a urologist is at the top of the nation of experts speaking about this. And my story makes sense. Like Steve Jobs said, when you look backwards, it all makes sense, right? So 7 years into practice here, I had a patient change my life by coming in with a sexual function issue. I didn't know how to help. And so I deep dove into female sexual function. Remember, I'm the urologist, like we make penises hard every day. I like how a woman said that and not a guy. So because of my knowledge in female sexual function, I'm like, sorry Bellingham, but I can't change the world just seeing 20 people a day here, I gotta get loud. So I started a podcast, I wrote a book, I did a TEDx, started knowing a lot about female sexual function. And people started to speak up. I also got very big on Instagram. And on Instagram, people said, but you know what happens to your sex life with menopause? Moving on, right? And then the next person's like, yeah, but you know what happens to your sex life with menopause? I'm like, that's a coincidence, that's two. Okay. Another one's like, yeah, but you know what happens to your sex life with menopause? And I'm like, shit. I don't know what happens to my sex life with menopause. And I'm staring down the barrel. Maybe I'll figure it out. So I did the same deep dive with menopause that I did with female sexual health. You guys, I have the 2 largest niches in the entire world. And what I learned is that hormones are incredibly useful for your sex life with menopause. But I also learned that not only does your sex life not have to decline, it can be your best sex life ever. And with my study from 2002, why does everybody think that a hormone that they make that goes through the roof with pregnancy, why do we think it's trying to kill them? Mm-hmm. And so I started to research all of that. And it's the cultural fear that is no longer supported by the science. And the other thing that makes me a rock star advocate for female sex and hormones is I take care of the men every day. And it's a perspective that the average OB-GYN just doesn't have. Because when a midlife guy comes in and he says, I don't have a libido, I'm gaining weight in the middle, I'm super tired all the time, we don't look at him and say, have you tried acupuncture and more yoga? And we love acupuncture and yoga, but it's not a treatment for hypogonadism. My friend, Dr. Rubin, said, if men's testicles fell off at average age of 52, there would be a national vaccine. So in medical school, I remember sitting right now and add 20 years to it. Where are you going to be? Who are you going to be with? What are you going to be doing? And I actually use this thought experiment in clinic because I see it. Now I see women. They're like, "It's my 50th birthday. I'm here," which is very fun and very cool. But I use that thought experiment because they're usually, if they're not having bad menopause symptoms, they're feeling pretty good, and they're trying to figure out, are these hormones right for me? What should I do? And hormones, like a healthy lifestyle, like exercise, lifting weights, and aging well, it works best to prevent disease, frailty, fractures. It's preventative health. And I would argue in our current medical system, we're much better at treating you when you're already broken than working on keeping you healthy. And so the thought experiment I use is I say, what do you want to be doing when you're 72? And now you got to work back. Right? So find 2 people next to you, tell them where you're going to be in 20 years, share your stories, and I'll give you 2 minutes. That's for another documentary. If men had a drug that if they took it between ages of 50 and 60, they lived on average 3 extra years, do you think they'd all be on it?
And it would be covered by insurance.
And yes, it'd also be covered by insurance. That's great. You guys are awesome. Women have that drug. We have the studies on that. It's called estrogen. Decreases colon cancer risk by 30%. Decreases heart disease by 50%. We're getting a little louder on it, but we do have a lot of data if you take it early, and what that means is before you're too much older, there's great data to say it probably decreases risk of dementia and all neurologic disorders by about 30%. If you're on hormone therapy, it decreases your risk of any fracture by 50%. In the Women's Health Initiative, actually, they get good data from it, besides completely destroying 2 generations of humans. But women who didn't even have a diagnosis of osteoporosis had a decreased risk of fracture on hormones. You don't even need the diagnosis to benefit. And there aren't many medications that are actually FDA approved to prevent diseases. That's actually a pretty rare moniker. Again, we are not very good at preventing diseases. We're much better come to me when you're sick. But estrogen has an FDA approval for the prevention of osteoporosis. Which is pretty impressive. Okay, I digress. What else are you gonna do? What? Lift heavy shit. And I would asterisk if you don't yet lift heavy shit. There are many well-trained people to help you do that wisely and smart. To work your way up to the heavier of the shit. But definitely body movement. What else are we gonna do? Stop? What about stop doing? What are we gonna stop doing? Drinking alcohol. I know. I always see who my super fans are. Who's listened to my podcast episode that dropped today? Yeah. My mom's here. My mom doesn't even know my brother's on this podcast episode. Do you know that? Yeah, it's all about our journey with decreasing alcohol. Really huge association with dementia and alcohol. It's nasty. I know. Makes your skin look good too. What else? Are we going to stop doing anything else? Sugar. What else? Lock up the chocolate drawer at work, perhaps, is what I said? I don't know if I got that right. Negative self-talk. Ooh, I love that. Your brain creates your reality, right? So make sure it's talking smart too. There's lots of cool stuff about that. Waiting? You're gonna stop waiting.
Stop waiting for men to understand.
Ooh, nice. They don't have our body parts. They don't need to tell us what we're going through. That's our job.
Yeah.
See, also, they don't have a clitoris. You have to tell them where that is too. And the problem with the real world is it's going to tell you what aging is like. It's going to tell you how to age. It's going to tell you the 20 bajillion supplements and everything else you need to spend to make somebody else wealthy for you to age well. You're going to be bombarded with the status quo. And what Gen X, so the oldest Gen Xers are turning 60 in 2025. Yeah. And the unique thing about people are like, why is menopause having a moment right now? And it's like, Gen Xers are watching their parents age. And they're starting to think, is there a different way to do this? is when you go out into the real world, you now have your future self that you're accountable for. I'm giving that to you to take with, because you're going to go back into the status quo of this is just how it is. You said, I don't think it has to be this way. I think I can do this differently, and I'm going to take all my friends with me, and I'm going to find the doctors that support me, the therapists that support me, the friends that support me, because when I'm 78, I'm still going to be on the stage changing the world. Air quotes, aging. It's because we're losing our protective hormones that help our bodies operate and function well. So genital urinary syndrome of menopause is GSM for short. It got named that because we didn't like the term vaginal atrophy anymore. But I would argue vaginal atrophy was better than the 1980s when we had senile vagina. I know. Actually, God bless the medical librarian at our local hospital, because I made him dig up this 1983 JAMA article, is where the original use it or lose it, which is a myth, by the way, for sex came from. And there's senile vagina all over that paper, and I'm like, holy crap, they actually did use that term. So when women come to see me in the urology clinic, they're already over menopause, right? Because this group of women, they thought it was a hot flash and they can't get pregnant anymore. That's what a lot of people think menopause is. I'm like, your ability to get pregnant and hot flashes are actually a symptom of ovarian decline in hormone production, right? And so they're like, what do you mean that, pain with sex and getting up at night and recurring UTIs is a menopause issue? I'm already over menopause. I'm like, no, hormones affect every tissue. It's in our inner ear. Vertigo increases after menopause, right? Gum disease. For me, the big one for my family is macular degeneration. And I looked up that and I was like, holy crap, I'm going to take hormones and decrease risk of macular degeneration. I'm on this stuff. I've seen my grandma go blind. So vulva, bladder, urethra, all that stuff is incredibly important. And I would add, for lichen sclerosis, which is an autoimmune, kind of a thinning, tightening of the vulva, that you get a 1-2 hit after menopause. You should also be on the vaginal estrogen. You can use it externally. That's why I have a cream bias. Clitoris and vulva can get the cream as well, to help treat that skin and get that skin as healthy as possible. That question. So the question is, what do you do about lab values? And I think it's a big, tension spot, because women are like, I went into my doctor and they wouldn't check my labs. And I'm like, you're 64, they're 0. I don't need a lab. You haven't had a period in 15 years. Right? And so I always say, the menopause experts will know when they're useful to get. Current recommendations with testosterone is check a baseline. I'm looking for that mystery menopausal woman with high testosterone. I've yet to find her. But we get a baseline, and then especially with testosterone, are you absorbing enough of it, but not too much? So we do a follow-up lab for testosterone. Those are kind of parts of it. There is a global consensus on testosterone for women. You can print it out and bring it into your provider. I would argue we don't have a global consensus on many things at this point in our world, but we do on women and testosterone. And so that would be check a baseline, check a lab after 2 to 3 months, maybe once a year, just to make sure you're still absorbing it. So that's testosterone. As far as estrogen, we really care about symptom improvement. And we don't treat that, because I want to get you to 57, but only in March. And in September, for the winter months, we want really a 64. Right? This is not like a fine wine. We're not trying to get you to a particular age. But, it's really, how do you feel? Are you sleeping? And if you're on the right, what they say, this is a ballpark, if you're on the right dose, your menopause symptoms should be improved by about 80%. But I want to educate people, because I really want them to think, how I think about this is it doesn't just matter how much estrogen I give you. It matters how well you absorb it. It matters how many estrogen receptors you have. It matters whether I'm trying to treat your insomnia or your hot flashes. right? So really, seeing somebody who understands all of that. I saw one, just an example. So I check labs, but I don't do them just to drain your body of blood quarterly and collect cash from it. Which there is a group of people that think that's necessary. I don't. If you're feeling great, I don't need to keep draining blood out of your system. But I saw a woman, she swore up and down that her lack of sleep issues was because of estrogen. She just was like, give me more, give me more, give me more. And I'm like, let's give it a try. And so I'm like, can we check like your estrogen level just to see where you are? She's like, I'm not sleeping, I think I need more. I'm like, check. So I drew her blood, it was 1,000. She's like, is that bad? And I'm like, not if I'm trying to sustain a pregnancy. Right, so you can check labs to be like, you know what, there can still be insomnia. Urologists are already skeptical of them because that group said we shouldn't screen for prostate cancer, and we know how that turned out. Right, so I'm already a suspect of them, and they said, for the primary prevention of any disease, hormone therapy is not recommended. Now, we do have an FDA approval for prevention of osteoporosis, so that already contradicts that. But I would say, people, they use that to say, you can't use hormones for primary prevention. That's not what it says. It says the nation as a general shouldn't put all the women on hormones, right? And I'm like, it's a very high bar to put 80 million people on a medication. We don't put everybody on a baby aspirin. We don't put everybody just on a statin, right? So the bar is very high to say all women should just, as primary prevention, take hormones. And I don't think that's going to change. Again, 7-year-old's not a 7-year-old's not a 7-year-old. We all have our individual health things. But I don't think that should prohibit you from saying, I would like to use these as part of my dietary, my sleep, my stress reduction, my lifting weights, my yoga, of my body plan for aging well. I think hormones are part of the female longevity movement. You're just not going to get a national organization to ever say it. It's too risky for them. I mean, the estradiol freaking saves lives. It's been exonerated from the breast cancer, and those companies got sued to the tune of $1 billion after the WHI came out, which is now wrong. Right? So the pharmaceutical industry, they're never going to say, hey, everybody, we think you should go on this for prevention. You're never going to say that. And even me, if I go on social media, and if I say that on social media, that you should be on this for prevention, they will tear me a new one. But since I love you all, because this is my town, to me, I'm like, the hormone experts, we see how people are aging, we see the incredible benefits, and we know that for the majority of people, it's incredibly safe. Incredibly. I would say, name me a medication that's safer, right? So it's a very long, nuanced answer as far as when do I start this for prevention. And I'll close just with an asterisk. Vaginal estrogen, the local skincare from down there, most people would say, hey, by 55, think about starting to use that. Because don't come and see me because you haven't had sex for 6 years and you're having your 6th UTI and you're getting up 4 times at night. If we know genital urinary syndrome of menopause affects 50 to 80% of women post-menopause, why are we not preventing disease instead of just waiting for you to suffer and then come in? Vaginal estrogen is over the counter in many countries. And when we start a woman on vaginal estrogen, we don't say, great, no more UTIs, why don't you stop? We're keeping her on it for preventative health, right? So I think specifically for the vaginal estrogen, it's a much more accepted thought process to say that can be prevention because it's so stinking safe, so safe. Any advocacy on that, if you guys would, go on to letstalkmenopause.org, unboxing estrogen. The FDA has a boxed warning on vaginal estrogen that says heart disease, stroke, and probable dementia might happen with this medication, so women aren't using it. The physicians have tried to tell the FDA to take this off, and it's not working, so now we're doing grassroots for the women to be like, FDA works for the people, get these scary labels off of these medications so we can have truth in the products that are given to us. Thank you.